Welcome back to Healthy Living. We're talking today about the national opioid crisis and its impact here locally in St. Tammany Parish. We're talking with St. Tammany Health System leaders who have taken on the responsibility of re-examining how our health system uses opioids in our market for patients and their pain needs. We talked first with Dr. Mike Hill, who talked about the global crisis and how it's affecting us locally and what our strategy is to resolve the issue. We'll talk next with Jay Morange, who manages rehabilitation for St. Tammany Health System, and we'll look at how physical therapy and rehabilitation can make a difference. Jay, welcome. We're glad you're here today.
Thanks for having me.
So talk a little bit about how rehabilitation or physical therapy has a role to play here.
So back in 2015, we were tasked with getting involved with our pain chapter as far as HCAHPS, which is the national scoring system of how a hospital does, and therapy got involved by bringing on pain blocks with total joints, and from there it kind of evolved to how can therapy play a role with addressing the opioid epidemic.
Okay, so really it was you going about your job and then you realize that there's a place that this has more applicability.
Right, and I think a lot of it is there's not a lot of education out there of what therapy can actually offer as far as modalities and an adjunct to pain management from the opioid perspective.
Right, and so talk a little bit about that. We in the clinical services say modalities and things like that all the time, but for patients what we mean is different ways to care. Is that right?
Right. So instead of taking a pain pill, you can go see a therapist, and there is pharmacology component to it, non-narcotic pharmacology, and then the therapy acts as an adjunct with that, and that makes a better treatment plan, a better standard of care versus the old way of just using a pain pill to mask your pain or heal your pain.
And I think you said something important there, mask your pain. So that's one of the things, particularly if what we have is pain in that patient's daily experience, they're looking to just make that pain stop. And so what you in physical therapy can do is help them reduce that acute pain, but also going forward, you give them some coping skills, some understanding of their own body mechanics, right?
Right. So being able to treat them with something other than a pain pill. So what I mean by that is we can offer modalities such as heat, ice, and very simple modalities, or innovative modalities such as taping and dry needling, which we've kind of marketed here at St. Tammany Health System from the hospital and outpatient side. So being able to offer that to a patient and letting them know that that's available out there versus that pain pill, and then going forward having that education and know, hey, I don't have to take a pain pill to be able to address my pain. There's other things out there that I don't have to face the risk of having a lifelong addiction to pain pills.
Right, and so dry needling I think is a good example. That has a connection to 3,000-year-old medicine, acupuncture,
right.
But it's modern Western medicine and an understanding of how that physical manipulation can resolve a pain issue. So can you talk a little bit about the medicine you're delivering there?
Right, so dry needling, we are using acupuncture needles, and you have to give acupuncturists credit. They've been doing this for 3,000 years. It's only in its infancy now with Western medicine. So you see a lot of research now aimed at how can dry needling affect pain for a multitude of diagnoses, from musculoskeletal pain, but neuropathic pain, and I don't want to get into too much of the litany of it, but just knowing that you can find an area of pain, put that needle in that area of pain, you insert it into the skin, into the tissue, and then that can help your body heal itself.
Very good. And our entire rehabilitation services division at St. Tammany Health System is certified in dry needling, is that right?
Just since this October, through the funds of our guild, who have wonderfully gifted us a grant, we were able to certify all of our therapists, over 15 physical therapists, from our outpatient hospital, and now we utilize this within the emergency room. But being able to be certified across the spectrum and offer that on a daily basis is a huge win for our health system.
Outstanding. So really you're talking about an approach that goes from the emergency department inside the hospital for inpatient care and outpatient rehabilitation for patients who may be referred by a physician or may simply choose of their own accord. I'm having back pain or shoulder pain or chronic pain. I'm going to seek an appointment with a physical therapist and see about some solutions.
Yeah, so that's direct access is what you're alluding to, and that recently just got passed where you don't have to see a physician. You know, a therapist can be a primary provider for that, by law, and we can see you, evaluate you, and address your pain. And if it doesn't get better, then we send you to the physician to get further care.
Right, and so maybe there are other parts of the health system that can help along the way, but certainly looking into what those chronic pain issues may be, they may very well have something to do with the physical carriage of the way that person is working every day or not stretching out their muscles.
Right. Yeah, and so I think therapists are well trained and well educated on being able to identify those issues and then come up with an appropriate treatment plan to address those issues going forward.
Okay. Can you talk a little bit about, you mentioned the emergency department offhand, and I think, for folks, particularly those of us who maybe have never needed to go to the emergency department before, you kind of have this mental picture of that's a place people go for heart attacks and strokes,
right.
But it's a lot more than that, and
right.
Many times people are coming there because they are in pain. And in the past, maybe the solution to that was to write a script for an opioid and release that patient. So how is physical therapy interjecting into that process?
So 1 in 5 patients that walk into an emergency room is there for pain.
Wow.
Right, it's a high number. And as you said in the past, the answer has always been, here's a pain pill. And we were all trained to do that, and that's what's always been done, but now we have a crisis on our hand. So like I said, using that what we call multimodal approach, so you have a non-narcotic pharmacology, so using anti-inflammatories or steroids or muscle relaxers to address from a pharmacy side, and then the therapy side will have that adjunct where you have someone come in via ambulance, they can't walk. Within 3 hours, through that medicine plus dry needling, we're able to have them walk out of the emergency room.
Wow.
So that moment of crisis, and then the patient sees within 3 hours their whole world change, positively. And then from that, we're able to have a follow-up and go see our outpatient therapy so they can continue their care and not be admitted to the hospital.
And right, you've resolved that emergency situation, kept them from needing a hospitalization.
Right.
And then in the outpatient setting, you can not only work with that pain issue, but also give them some education for stretching and some things they can be doing
Right.
long term so that once that pain is controlled, it can remain controlled.
Right, and the huge win in all of that is they're never exposed to the opioid to begin with. And that's where we've kind of evolved. When we started out, we wanted to address opioid tolerant patients who were already, on opioids from a lifelong, need for them.
Right, our last 20 years of medical
Right.
practice was to prescribe,
Correct.
and so we were looking to reduce that.
And so we can still address those patients' pains and be that adjunct, once that opioid's been removed. But to have someone come in and never be exposed to begin with is really, where we've kind of aimed our goals towards in addressing people's pain.
Fantastic.
Yeah.
Well, Jay, thank you so much for coming in. This has
Appreciate
been
it.
really interesting.
Yeah.
Thanks
Yeah.
so much.
Exciting.
Up next on Healthy Living, we'll be talking with Bert Lindsay, who'll talk with us about the hospital setting, opioids, and pain reduction.